Video number 3 of 10, US healthcare supply chain. Why is this important? When you mention access to care and you say one of the biggest problems in dentistry is the lack of access to care, you need to know how difficult it is for care to access patients. And that means that care has to cross all the roadblocks in the healthcare supply chain to access patients. It's very interesting I said care accessing patients and not patients accessing care. So let's get into it and understand what is the US healthcare supply chain. I'm going to draw this for you. There are a heterogeneous group of people actually involved in the healthcare delivery supply chain. First, we have funders. Funders are the people who pay for your healthcare sources. That could be Medicare, Medicaid, government, state government, employers, and any other philanthropic activists. The second is your providers. The providers are who you guys are. The dentists, the doctors, the health system, hospital organizations, the DSOs, the ACOs, and so on. The final person are suppliers. So suppliers could be your Dentsply Sirona, medical device companies. It could be your pharma companies making medication. It could be some other company providing managed care services. It could be a nursing home that's working separately. People who supply equipment, medicine, and add-on services that a doctor cannot provide. Now, how are they connected? In between the funders and providers, so we saw funders could be your employer who pays for your insurance. It could be sometimes people paying for themselves in terms of like going to the pharmacy and paying out of pocket. So that's out of pocket costs. We have the federal government and the state government. In between the funders and the providers, who are your hospital systems, who are your private practitioners in dentistry, who are your DSOs, ACOs, and other group practice organizations or franchisee organizations. Between them are two crucial members. Number one is your health plan, and number two is your PBM. You must have come across these names in the past, but I'm going to explain what they are to you. Next, between the providers and the suppliers, we have what we call distributors. Now, these distributors are your pharmacies like CVS or a Walgreens. They could be specialty pharmacies who just carry material through their cold storage from one place to another. But the supplies cannot reach the providers if the distributor has his own contracts or has his own way of negotiation between. And this could be a crucial impact factor. Two popular distributors you wouldn't have imagined are Walmart and Amazon. And I'm not talking about their store services. I'm talking about their back office. They can negotiate which medicines reach provider systems because they are connected between these two groups. Having said that, let's see one more group which is outside this entire supply chain. And that one big group is your patient. Can you see how your patient is the least neglected in this complex supply chain? This is why the US healthcare system kind of takes a lot of criticism. However, it works really well and for many reasons. So the funders pay for the consumer's healthcare and the providers provide healthcare services. Suppliers supply medicines and medical devices, but primarily through the providers. So they don't have a direct connection. It's slightly disconnected. Unless you have some mail order pharmacy sending you medicines each month. Now, if you talk about access to care, a patient must cross all these hurdles to actually get care delivered to them. And this is why it is super complicated. In subsequent videos, I would be explaining to you what each of these individually are. What is a PBM? What is a health plan? Who are funders? What are providers? Why is things complicated? Why are pharma companies over here, pharma and medical device companies, charging so much? How come everybody in the healthcare system points fingers and blames everybody else for the excessive costs that the US consumer pays to access good healthcare? Let's get all these questions answered for you because they will matter in your interviews and, more importantly, in your healthcare business career.
If you want to make your CAAPID application process easier, hit subscribe now, show your support and love, and we will keep helping.